Arthritis Day, 12th of October, where we are celebrating the bone care. And why the bone is important, for that we have very eminent orthopedician among us. Before I go into the formal introduction of the sir, I just invite him and welcome him to this Mankind Pharma Tower. And I request Dr. Sandeep Mitra sir, kindly welcome Dr. Ashish Chaudhary sir, and I request. Sir, I request if you can sit on the dais, sir. And I request Dr. Sanjay Kaul sir, so kindly sir join also on the dais. Before we go into the scientific session and the awareness program, although we all are from Mankind Pharma, still there are many things which we are not aware about the Mankind Pharma. So in few minutes, I will just go through the Mankind corporate overview. Like you have already been aware that Shri R.C. Juneja sir, and it has been always been our vision to be a global pharmaceutical company which is most admired for its quality, affordability, and accessibility of the products. And till date, we are following this philosophy. And to this philosophy, there is always, we always do this thing, and I will going to show you one video which is the core of Mankind values, the Mankind anthem. So may I now request the IT team to kindly start the Mankind anthem.
हमसे बेहतर हम बोलो वंदे मातरम, आत्मनिर्भर हम बोलो वंदे मातरम। शून्य में संभावना आता हमें है देखना, विश्वविद्यालय तक्षशिला विश्व को पहला मिला, शल्य सुश्रुत प्रदान है, दुनिया के लिए वरदान है।
लोक के कलिसिद्धे नावु वसुधैव कुटुंबकम्, आत्मनिर्भरनु अतिवन्दे मातरम्, नमगिल्ल सरिसमरू अतिवन्दे मातरम्। యోగమే రామబాణం తరతరాలై జ్ఞానం, తాజ్ మహల్ తలమానికం దేశపు గర్వ కారణం, కొల్లూరులోని కోహినూరు విశ్వమంతటికి జోహారు, రామన్ కండ కోట్పాడే రామన్ విளைவின் வெளிப்பாடே। ఆత్మనిర్భరనా చొలువందే మాతరం, నాములకం వెల్లుం చొలువందే మాతరం।
स्वदेशी अपनान लगे, विदेशी बजान लगे, हो जाता है सिलसिला जो जनते पानी है मिलिया। USB भी असी दिता, ना पुछो की है किता, हर गोबिंद दे है नाज सानू, DNA दा राज सानू, देश दी स्वदेश दी है खोज पेंटियम। आत्मनिर्भर हाँ असी वंदे मातरम, अपने तो बेहतर असी वंदे मातरम, आत्मनिर्भर हाँ असी वंदे मातरम, अपने तो बेहतर
मैनकाइंड फार्मा, दिल से स्वदेशी, जान हिंदुस्तान।
So this is what the India is in our heart. So this is why if you see our progress, our growth has always been concentrated on our Indian domestic market. But as of you know, Mankind Pharma is currently the number 4 in the rank in the Indian pharmaceutical market. And we are the youngest company to achieve this feat. The last year revenue of more than 78 billion Indian rupees, out of this 98% is domestic revenue. Again, India is in our heart. We have been making progress in R&D segment also. Many of you who are not from the marketing and sales point of view, they might not be aware that we have currently started our another R&D center, and now we have 4 world-class R&D centers where more than 600 scientists are working day and night. Recently, we have established our biological plant where we are developing pembrolizumab. So most of you which are not aware, pembrolizumab is the anti-cancer drug, and we have already started working on developing its biosimilar product for this therapy. Not just that, we have been making progress in new drug discoveries as well. So in diabetes, as you are aware, GPR119, which is the target protein for the anti-diabetic molecule, which is currently in the phase 1 of clinical research. Other than that, we have autoimmune disorder like JAK-STAT, and there are other products in such as oncology and immuno-oncology as well. Now, what is the progress? The going ahead, the path in front of us is the DMF, the Drug Master File, and of course the clinical research further. Drug Master File is something which is very much needed for our Indian patients, because DMF quality API, this brings the high quality API, of course manufactured and tested as per standardized US and European pharmacopoeia. It meets stringent global regulatory standards and of course good manufacturing practices compliant. So this is something as a mission Mankind Pharma has taken. For the next few years, we are going to have DMF quality API for our products. We have been doing strategic acquisitions and in-licensing agreements as well. Like just 1 or 2 years back, we acquired Panacea Biotech's India business, and we also acquired some of the brands also from the leading pharmaceutical companies. We have been doing in-licensing also, for example, with the Novartis for the sacubitril/valsartan molecule. We have been doing more than 50 clinical trials, including PMS, various research projects, smaller projects to large-scale randomized clinical trials as well. Say ophthalmology, gynae, respiratory, anti-infective, gastroenterology, almost each and every therapeutic area, we have been working towards developing newer and newer evidences. So with this, I once again welcome all of you to this awareness program where we have eminent orthopedician, Dr. Ashish Chaudhary sir. Dr. Ashish Chaudhary is the Managing Director, Senior Consultant and Head, Orthopedics and Joint Replacement at Akash Healthcare Super Specialty Hospital, Dwarka. Sir has many publications in national and international journal and has been principal investigator in various clinical trials. Not just academic. If you see biodata, I'm allowed to say that he has been a business entrepreneur also. He has been awarded a CEO of the Year Award, which is 16th edition of Stars of the Industry for Excellence and Leadership Award 2023. Prestigious Healthcare Award and Medallion, the Indo-Uzbekistan Health Forum. Distinguished Doctor of the Year by SOCHM. Best Orthopedic Surgeon in North India at World's Greatest Brands and Leaders 2023. And Distinguished Entrepreneur Award at PhD CCI Annual Awards for Excellence. So with this, I once again welcome and I request all of you to a huge round of applause for Dr. Ashish Chaudhary sir.
Thank you so much for the kind introduction. And at the outset, I would like to thank the entire Mankind family, especially the leadership team. Junaida ji, senior Junaida ji is not here. I also dreamt to meet him, but definitely there will be an occasion in future. Uh, the association with Mankind Pharma goes long back, since the time I've been into orthopedic practice, even before taking charge of hospital operations. Right from that particular time, I have been interacting with the people, the ground force coming to our hospitals, clinics. In one way or the other, they have been trying to associate. One thing which I could now resonate looking at this presentation, the inclination towards India, the defense forces, and the respect being shown even in their national anthem. I can see the same qualities have been instilled either through training or through persuasion in the entire workforce which is there working along with the doctors, trying to get them on board. It's not only the marketing effort which works at the end, it's the quality, it's the the efficiency of the products, and also the affordability for the patients at the end of the day. That makes all the difference. And we have seen in last many years the brand has grown leaps and bounds. All the brands which come into my specialty of orthopedics, we have seen being written world over, across the India. All my colleagues have got huge amount of respect because of the quality as well as the affordability. So big round of applause for the entire Mankind team. Starting from the top, the leadership always gives that signal, which way to go, which direction to follow, and I think that is reflected right at the last mile, which interacts with the patient, with the hospitals, and the clinicians at large. So today being a special day, World Arthritis Day, although it's not celebrated as high as Diwali, but for medical professionals and for people like you who are actually making difference in lives of so many people with suffering from arthritis through your contribution in terms of getting those right products to the right patients, or through the medium can be hospitals or doctors or whatever, and also the research team which is working day and night to bring about new products which probably will solve the unsolved problems pending because of the inefficiency of the previous generations of products. So that innovation which is happening, and already whatever successful products are there in market for handling patients of arthritis, addressing all their concerns and problems, I think we have a solid case to, and a lot of my experiences, information. Me being an orthopedic surgeon, obviously we want patients to come here for get the surgery done, but 95% of patients they are practically surviving and staying healthy and happy with the products Mankind Pharma produces, or similar products available in the market. So this special day which is celebrated on 12th of October, I wanted to raise some history behind it. It's been celebrated since 1996, and it's purely focusing on creating awareness about the arthritis. A lot of, I mean, you are into medical field, but the end users, the patients, the elderly population who are now 60s and 70s and struggling because they're not able to walk around, they're not able to carry out their daily chores, primarily because of arthritis, but they don't know what to do. So I think days like this, and also reaching out to those people, English medium से, Hindi papers से, education seminars से, इन सब चीज़ों से I think it makes all the sense to reach out to maximum number of population so that they are benefited, they can take steps for the early detection and management of their ailments. So arthritis, जैसे आप सब लोगों को मालूम है कि itis means inflammation, so arthros means joints. So anything which is causing inflammation of any joint will be called as arthritis. Arthritis एक बहुत wide term है जिसमें different types of arthritis आते हैं. More than 200 types of arthritis are known to the medical community. There are some common ones which I am going to share, but anything which is causing trouble in एनी जॉइंट विच इज़ मूविंग इन द बॉडी. हमारी जॉइंट्स में कई सारे जॉइंट्स होते हैं, जैसे कुछ फाइब्रस जॉइंट्स होते हैं लोअर बैक के, कुछ जॉइंट्स ऐसे होते हैं जिसमें मूवमेंट कम होता है लेकिन स्टेबिलिटी ज़्यादा होती है. कुछ ऐसे जॉइंट्स होते हैं जिसमें मूवमेंट ज़्यादा होता है, जैसे शोल्डर जॉइंट है, बहुत मूवमेंट होता है. तो जितना मूवमेंट होगा उतना वियर एंड टियर होगा. इसलिए वो जॉइंट्स जिसमें मूवमेंट होगा, जो सरफेस जॉइंट्स होते हैं यानी कि उसके ऊपर बहुत ज़्यादा मसल कवर नहीं होता, दे आर वेरी प्रोन टू गेटिंग इंजर्ड. वियर एंड टियर जस्ट लाइक नी जॉइंट, शोल्डर जॉइंट and hip joint. Hip joint being a very deep joint, still because of some special activities by our people, squatting, Indian washroom usage, इन सब चीज़ों से उस joint पे भी बहुत pressure पड़ता है. So अगर हम बात करें pathology का, there are two types of primarily main types of arthritis. One is osteoarthritis and other is rheumatoid arthritis. Rheumatoid हम बोलेंगे ये यूजुअली यंगर पॉपुलेशन में होता है और फीमेल्स में ज़्यादा होता है, वेयर ऑस्टियोआर्थराइटिस कैन हैपन इन बोथ द सेक्सेस इक्वली. इवन देन बिकॉज ऑफ अदर प्रॉब्लम्स लाइक लेडीज़ को पोस्ट मेनोपॉजल ऑस्टियोपोरोसिस भी हो जाता है, ओबेसिटी भी होता है बिकॉज वो बहुत ज़्यादा घर से बाहर नहीं जाती हैं, सनलाइट एक्सपोजर नहीं होता, उसकी वजह से ऑस्टियोआर्थराइटिस भी फीमेल्स में ज़्यादा कॉमन होता है. बट रूमेटॉइड इज़ एक्सक्लूसिवली, आई वुड से 80 to 90% ऑफ पेशेंट्स आर फीमेल पेशेंट्स. तो रूमेटॉइड आर्थराइटिस क्योंकि ब्लड टेस्ट में भी आता है, इन्फ्लेमेशन से होता है, तो दिस इज़ मोर एग्रेसिव. ये जल्दी इफ़ेक्ट करता है, अर्ली एज में इफ़ेक्ट करता है. यंग पॉपुलेशन जो कि प्रोडक्टिव पॉपुलेशन होती है उसको इफ़ेक्ट करता है. सो हमारे लिए रूमेटॉइड आर्थराइटिस एक ऐसा डिजीज़ है बिकॉज इसमें पेशेंट सफ़र बहुत लंबा करता है. इफ समबडी गेट्स रूमेटॉइड आर्थराइटिस इन सेकेंड डिकेड, दे आर गोइंग टू सफ़र फॉर नेक्स्ट 60 years and the management becomes problem. And when you are taking so many medicines for 60 years, you can imagine how many side effects that patient is going to have. So our idea is to identify early what kind of arthritis it is and give them adequate treatment much early on, because जो लोग early treatment नहीं लेते हैं वही land up करते हैं orthopedic surgeon के पास सर्जरी कराने के लिए. So ये different types of arthritis है. Osteoarthritis मैंने बताया सबसे common होता है, which you see in any elderly more than 55-60 years, जिनको घुटनों के दर्द, टेढ़ापन, इम्बैलेंस, ये सारी चीज़ें आपने सुना होगा घर में दादा दादी नाना ने सब बताते हैं कि हमसे चला नहीं जाता, सीढ़ी नहीं चढ़ा जाता, नीचे बैठ के उठा नहीं जाता. वो सारे ऑस्टियोआर्थराइटिस कैटेगरी में फॉल करता है. देन रूमेटॉइड इज़ वन ऑफ द इन्फ्लेमेटरी आर्थराइटिस. गाउटी आर्थराइटिस जो बोलते हैं, इट इज़ ऑल्सो कमिंग अप बिग वे, स्पेशली उन लोगों के लिए जो आजकल बहुत ज़्यादा प्रोटीन्स खाते हैं, जैसे जो जिम जाते हैं. अनफॉर्चुनेटली हमारे जो इंडियन प्रोडक्ट्स हैं, जैसे हम बहुत सिंपल लैंग्वेज में आपने सुना होगा सत्तू होता है, अब वो पॉपुलर नहीं है, नोबडी ब्रांड्स दैट, इट इज़ कॉस्ट इफेक्टिव, उसमें किसी का प्रॉफिट इतना नहीं होता. बट हम जो वे प्रोटीन्स हैं, जो हर आपको हेल्थ कार्ट है, इतने सारे ब्रांड्स हैं जो सब जगह मॉल्स में आपको मिलेगा, 5,000-10,000 का डब्बा मिलता है. दोज प्रोटीन्स आर वेरी हाई लेवल प्रोटीन्स. मतलब अगर आप, और उसका जो कंजम्पशन है, इफ समबडी 60 kgs वेट, सो इट इज़ ऑलमोस्ट 60 grams पर डे दे कंज्यूम दैट काइंड ऑफ प्रोटीन. इतना प्रोटीन बॉडी को आदत नहीं होता है. एंड स्पेशली इफ़ यू आर टेकिंग सो मच ऑफ प्रोटीन, you have to take so much of water also, so at least 5 liters of water, otherwise it's going to choke all your kidneys. It's going to land, somebody is going to land up in gouty arthritis, somebody is going to land up in kidney problems. I have seen 20-year-old guys with hefty bodies, huge biceps, but the creatinine level is 1.8 because they have been on anabolic steroids and proteins for almost 4 to 5 years. So that's something, ये न्यू एज प्रॉब्लम है, बिकॉज एवरीबडी वांट्स टू लुक गुड, वांट्स टू बिल्ड मसल्स, एंड दैट लीड्स टू सम काइंड ऑफ आर्थराइटिस एज वेल. जुवेनाइल आर्थराइटिस, अभी आते हुए एक पेपर मीडिया इंटरेक्शन हो रहा था, उसमें दैट वाज द टॉपिक वेयर 16 ईयर्स से नीचे जिन लोगों को आर्थराइटिस हो जाता है, अगेन दैट्स अ टाइप ऑफ इन्फ्लेमेटरी आर्थराइटिस जिसको हम ऑटोइम्यून कहते हैं. ऑटोइम्यून मीन्स आप ही का अपना इम्यून सिस्टम इज फाइटिंग अगेंस्ट योर ओन बॉडी सेल्स एंड स्टार्ट डिस्ट्रॉइंग इट. They identify your own body cells as enemies and they start killing it. So juvenile arthritis is also another problem जो teenage में बहुत जल्दी आता है. Unfortunately वो identify नहीं होता. लोग अपने आसपास पड़ोस के MBBS डॉक्टर्स को, बाकी सर्विसेज में आयुर्वेदा सब जगह दिखाते हैं. By the time they identify, it is already too late. Ankylosing, lupus, psoriatic. Psoriasis is a skin problem जिसमें white patches हो जाते हैं. और अगर किसी को एक इसका पर्टिकुलर कैटेगरी होता है सोराइटिक आर्थराइटिस म्यूटिलांस. म्यूटिलांस मतलब वो सारे जॉइंट्स को इतना सिवियर फाइब्रोसिस कर देता है कि पेशेंट इज हार्डली एबल टू वॉक. I still remember one patient, I remember the name also, Dinesh. That guy was brought to us after he was 22-year-old और सारे joints उसके fused थे, 10-12 surgery हो चुकी थी. He was totally bedridden, didn't have father. Mother used to take care of the child. He brought that patient एक करके right hip, right knee, left knee, then fingers, everything was operated one by one. And then put on some disease modifying agents. 2 साल लगे, वो पेशेंट आज अपने आप चलता है, मूवमेंट करता है. Obviously he is not as good as he can't run, but he can carry out his daily activities. So ये इतना disabling है imagine for a 27-year-old person having the entire body getting involved by one of the arthritis. So arthritis जो ये वाले हैं, ये productive age years में affect करती है. That's more important. जिसको osteoarthritis 60 साल में हुआ, 70 साल में, they have already lived their life. They don't have to run around, they don't have to jog, they don't have to do those, they are not the bread earners most of the times. And उनके लिए फिर भी घर में बैठना, basic activities reduce करना is possible. But for the rest of the population, young population, they have to earn the bread also, they have to keep themselves mobile and they have to control the disease. अब ये जितने भी हमने फॉर्म्स बताए, जैसे चाइल्डहुड आर्थराइटिस जुवेनाइल होता है, chronic connective tissue, these are all autoimmune disorders. Infectious arthritis, lot of India is a hub of tuberculosis. अब tuberculosis joints में भी होता है, hip में, knee में, fingers में, head में, everywhere tuberculosis can happen. And if it is not treated in time, it causes arthritis much early. Then metabolic arthritis like our uric acid, gout and all. Septic arthritis usually affects the kids. बच्चों में जो बिल्कुल प्रीटर्म बेबीज होते हैं, उनमें कोई भी खांसी जुकाम होगा, वो वहाँ से ट्रांसमिट होके हिप में या नी में चला जाता है. और बच्चों में बोन नहीं होता, कार्टिलेज होता है, एंड कार्टिलेज इज वेरी सॉफ्ट. द मोमेंट द बैक्टीरिया एंटर्स एनी जॉइंट एंड डिस्ट्रॉयज द जॉइंट इन 2 days. तो अगर हमने 2 दिन में बच्चे को आइडेंटिफाई नहीं किया तो वो जॉइंट डिस्ट्रॉय हो जाएगा एंड द चाइल्ड विल बी क्रिपल्ड फॉर एंटायर लाइफ, विल कीप ऑन रिक्वायरिंग सर्जरीज every 10 years, 15 years in life. So it becomes all the more important. एक simple tip होता है कि किसी भी mother is the best you can say doctor to diagnose such a problem. अगर उनको पिछले 8 घंटे से किसी भी बच्चे का हाथ पैर कोई चीज़ कम चल रहा है तो they must consult a doctor, because बच्चे को अगर कोई प्रॉब्लम है बता तो सकता नहीं, तो वो तो चलाना बंद कर देता है, उस चीज़ को मूव नहीं करता है, एंड दे स्टार्ट क्राइंग, दे स्टॉप फीडिंग. These are the subtle signs जिससे हमें लगता है कि इसको अर्ली आइडेंटिफाई किया जाए so that right treatment can be taken before it is too late. Risk factors, all of you know, advancing age, obesity, females are more prone to inflammatory arthritis. A lot of genetic predisposition is there in inflammatory arthritis like rheumatoid arthritis and all. Environmental factor, of course, if you are, you have got inflammatory arthritis predisposition and you are staying in a place where there's a lot of, the winters are harsh. So all these diseases get flared up. All rheumatoid patients, like asthma, their disease progression and the requirement of drugs increases in winters. So even if you have to change your lifestyle, change your work profile, where a lot of these inflammatory arthritis improve if you are physically mobile. If you have a desk job or a IT professional sitting on a chair for 8 hours a day, that's not the profession which can actually control your disease. And then a lot of injuries post-traumatic. So in our hospital, for last 4 years, we have seen so many war injuries from Yemen and Iraq. Everybody comes with post-traumatic arthritis. So those injuries, gunshot, bullet injuries, rocket launcher injuries, everybody gets those injuries. They get the arthritis as bad as a 70-year-old at the age of 22 and 23 because of those damages which happen because of fractures. Causes, wear and tear is the commonest cause for osteoarthritis, autoimmune types of arthritis. Then increased uric acid. Of course, obesity causes. Today we advised knee replacement to a 41-year-old female because of the heavy weight. She was having very severe arthritis. So that X-ray, if I don't know the age, it is almost looking like a 65-year-old. At 41, she is having very severe arthritis because of the body weight. So these are the major causes why somebody will get affected from one or the other form of arthritis. Most common symptoms: swelling, pain, stiffness, deformities, difficulty in moving joints. So these are the common, and instability comes in at the last, where the patient is walking on a slightly uneven surface, they tend to fall, and that also leads to lot of issues like osteoporosis, leading to fractures of the common areas. Complications, they stop moving, the weight increases, the back also get affected, and then weight increases, that puts more pressure on the ailing joint. The vicious cycle keeps going on and on, and doesn't discriminate. We have seen 12-year-old kid with arthritis, we have seen 95-year-old also with arthritis. So there are all varieties of arthritis which can affect even a toddler till the elderly. Looking at the statistics, you can see how much arthritis market is growing in terms of the amount of money spent on their treatments, whether it is medical treatment, physiotherapy, or the surgical treatments, and it is growing by the year. You can see the data. We have got some Indian data also. Specifically, rheumatoid arthritis. You see, India is one of the hubs. India, Pakistan has got a very high density of rheumatoid arthritis, and then North America, some parts of Mexico, and some parts of Europe also is a epicenter for rheumatoid arthritis affection. Treatment includes analgesics, anti-inflammatory medication, counter-irritant gels, and anti-rheumatic medication. These are something which it works just like diabetes. You get OHS for diabetes medications. Similarly, if you are very diligently following the advice of the rheumatologist or orthopedic surgeon for your DMARD's medication, it definitely controls the disease to an extent. And then, if you are in continuous dialogue with the treating clinician, I think you can reduce the side effects and still maintain the disease at the right level. And new thing is the biologics, which has come up in last few years, although the pricing is still out of reach of many people, but still going forward, and companies like Mankind working on the cost, I think it's going to be available to the last person in India. And corticosteroids, they are you can say necessary evil for these kind of arthritis, but unfortunately बहुत indiscriminate use होता है steroids का by all the doctors, because it gives instant relief and it helps in retaining the patient for longer time. I think that should not be the approach to treat rheumatoid patients, because it's going to improve the symptom temporarily, but long term mein corticosteroids has got ill effect. Everybody knows steroids can harm all the body functions, including from eye vision to spine to the liver, and all other organs get affected if we are taking corticosteroids in regular dosages. In fact, COVID is a perfect example where now we are seeing patients of long COVID disease where they were affected with COVID. Anybody who has taken more than 4 or 5 doses of corticosteroids during COVID treatment, and now they are getting affected either with a permanent lung problem or with a hip disease which is called avascular necrosis. So many young patients are coming who are requiring hip replacements because of the treatment by corticosteroids during COVID. Medication is, all of you know what we discussed, glucosamine and stem cell therapy. Now these are being recommended to all those patients who might want to wait for surgery or who don't want to undergo knife. So these are all, I would still say, far from a very predictable solution. Sometimes we give stem cell treatment or a PRP treatment. किसी को फायदा होता है, किसी को नहीं होता है. अब 10 में से 3 को हो जाएगा, 7 को नहीं होगा. Now the challenge is, जिनको नहीं होता है, उन्होंने कुछ money spend किया होता है, उनको लगता है this is an expensive treatment. This is not just like a calcium tablet. It's a little more expensive. So cost effectiveness, अगर 90% success rate नहीं है, so it becomes difficult to convince patients that the results will be predictable. So I think a lot of research is still going on in various corners. Hopefully we'll have more predictable solutions before anybody ends up getting a surgery done. Natural solutions, diet modifications, physical therapy. Diet is something which everybody knows that how much junk food is playing a havoc in our lives, but nobody is doing anything. And every Friday, Saturday, you go to any mall, there's no seat in the food court. You keep looking for a seat, and keep standing in lines of Domino's. Still, it happens. So, solution everybody knows, but nobody follows that. Physical therapies like these braces and belts, yes, these are only external supports for some time. It's a temporary solution, but one should go back to some kind of physical activity. If somebody is not able to walk, they have to do some in-bed exercises. There are solutions available for all kinds of patients with all kinds of ailments, where we can find some ways to keep the joints moving. Surgery, complete replacement, partial replacement, arthroscopy, osteotomy, there are so many options available depending on the patient's condition, we advise. And last but not the least, 3D printing technology. Now this has come up, coming up big way in healthcare. We have our in-house 3D printing lab for treatment of complex clinical situations. But of course, for arthritis, bioprinting will be a solution. It's not commercially available. It is going through, like you have got your phase 1, phase 2 trials. The bioprinting is a very futuristic concept, wherein if you have a cartilage damage, you can take a small piece of the normal cartilage, print any number of grams of cartilage and put it back wherever you want it. You can print skin, you can print tendons, muscles, anything can be printed which is missing. There is a road traffic accident, the entire forearm muscle is gone. You go back, you give the structure, anatomy, take a CT scan of the other side, what is missing, take out what is left, give the command, and they will print those muscles and you attach it back in the body. So that's definitely going to happen in next few years. So as I told you, so many side effects. People think that it's better to stay, diseased rather than take those medicines and suffer from the side effects. And prevention, of course, it is the best remedy. Unfortunately, that's the area where we don't focus too much, like maintaining body health, calcium, vitamin B12, D. Now, one question I would want to ask, what is your perception about vitamin D? कौन से खाने में vitamin D होता है? Anybody can volunteer? Vitamin D का source जो आप रोज खाते हैं, उसमें तो कोई ऐसी चीज़ जिसमें vitamin D होता है और कितना होता है? कुछ कभी किसी ने सोचा? हमें vitamin D कहाँ से मिलता है? मिल्क से और एग से और fish. Okay, majority of our population is vegetarian, and Delhi fish availability again is a challenge. So we feel that 80% majority would be vegetarian, not having access to fish. In your routine vegetarian diet, North Indian, South Indian, anything your parents or your grandmother must have told you, kuch vitamin D rich source, anything else you can think? People say broccoli. How many people have broccoli every day? How about sunlight? When is the last time you stood in sunlight for 30 minutes? Can you recall that day? I don't think so. We don't have, unless we are laborers, we will not be standing in sun. So if you talk about food, if you talk about milk, unless it is fortified with vitamin D, it doesn't have any vitamin D. So बहुत सारे पेरेंट्स आते हैं तो इतना दूध पीते हैं, 2 बार पिलाते हैं बच्चे को, फिर भी इनका विटामिन डी इतना कम है. तो मैं कहूँ भाई विटामिन डी होता ही नहीं उसमें, विटामिन डी कहीं से डला होगा तभी उसमें होगा. सो लॉट ऑफ कंट्रीज जस्ट लाइक इंडिया हैड अ प्रोग्राम फॉर आयोडीन. टाटा के नमक में आयोडीन होता है, ये पहले नहीं होता था. 20-30 साल पहले तक जब हर बच्चा पैदा होता था उसको कंजेनाइटल हाइपोथायराइडिज्म हो जाता था. सिवियर हाइपोथायराइडिज्म कॉजेज mental retardation in all the kids. There was the big, movement which actually led to addition of iodine in the salt, because salt is something which you're going to have every day. So that kind of revolution happened. Then white revolution happened for milk, led by Amul, and so many such revolution happened. I think vitamin D also needs that kind of attention from the political sources, because that's something which is easily doable. Only thing is the milk becomes costlier. Okay, so in India, the cost is a major factor. Fortification of anything, unless it goes to a mass level, everybody starts doing that, it becomes a mandatory thing. It's not going to, come cheaper. You go to any foreign country, you go in those 7-Eleven stores, everywhere they will have written fortified with vitamin D. There's only one product which has come in Indian market, that's Bonvita. Again, there are a lot of ill effects have been reported, why it is so much of sweetness and this and that. So yes, they added vitamin D, but there are a lot of other effects. But kids love it because it's quite sweet. So there's no vitamin D in milk. In fact, egg has got only 40 units of vitamin D, whereas our requirement per day is not less than 800 to 1000 units. So imagine how many eggs you have to actually get adequate vitamin D from your egg intake. You cannot have 50 eggs a day. And sunlight we talk about, even if you're standing in sunlight, your arms, legs, all are covered. Unless you have 40% body surface area exposed for more than 30 minutes, that too in a medium or a fair person, it's not going to generate vitamin D. हम क्या है 5% expose होता है face or hand, that's the maximum. Especially for females, it becomes difficult to have 40% exposure. So in Indian scenario, sunlight is also ruled out because that's never going to happen. 40%, and that too in early morning hours, 7 to 11. You are either getting ready, you're going to the office, you are sleeping, night duty wala so raha hoga. So and on a daily basis. So easiest is refer to Mankind's products twice a month. Twice a month, two capsules or liquid sachets or whatever, 2 doses in a month. जैसे वो पोलियो का है 2 बूंद जिंदगी की. So there are 2 doses per month is the minimum anybody more than 12 years of age should be taking. So you must recommend to all your family members, parents, जो कभी नहीं खाया, पूछोगे 6 महीने में किसी ने नहीं खाया होगा. So 2 doses per month हर एक को लेना है. 24 doses होती है. Even a 1-month-old child requires 1 dose a month. So less than 12 years, it is once a month. More than 12 years, twice a month. So there is no natural source of vitamin D. So that's the best way. Refer to Mankind. Again, prevention, body weight monitoring. I mean, you have to make the food courts run for their money if you really want to implement this. And then a lot of yoga exercises. I'm not sure, it's difficult to pronounce these words, but it must be even more difficult to actually do these yoga asanas. So first time I had an exposure with yoga asana was not in India, but on Stanford campus few years ago, where I was there to attend a program, and they had a mandatory, unless you attend the morning 6 to 7 session, you will not be allowed to enter the design thinking class. And that session was taken by an American, got us do 40 minutes of yoga, and it was a horrible experience. I never had that much of pains, and I realized that yoga is so difficult. So yoga is actually very difficult if you do it religiously and some mentoring is there. Sunlight, it's again I told you 7 a.m., 9 a.m., it's very difficult. So, and I told you that around 30 minutes of exposure. It also depends on the weather, what is there, rainy seasons, winters, hardly any sun is there, and the skin color also affects. So for lifestyle modification, there is no replacement. Yeah, so one particular slide which is obviously close to our heart. Unless I talk about surgery, no talk will be complete. So this is a slide, it's quite an old slide. We got some due diligence done by one of the consulting firm about the market size of knee replacement and the arthritis problem. So if you see in India, there are almost every year 12 lakh people are reaching the end stage of the disease, and they are the people who require joint replacement, whereas only actual joint replacement happening in India in 2020 was 2,20,000. So it's almost 5 times more demand is there, and these are those patients who have done everything, tried all types of medicines, physiotherapy, everything, and now they are at the end stage. They cannot get anything better except for the surgery. Even then, we are only managing those 1/5 of the patients. So a lot of scare is there around procedure, and of course, scare is genuine because somebody who, because they are elderly population, diabetes is there, hypertension, heart and stroke issues are there, and if the surgery goes wrong, then there is no recourse, and there is a lot of suffering. And not just the patient who suffers, the entire family suffers. There something goes wrong, so one has to have a very clear selection for the operating team, the environment, the post-operative rehabilitation. Everything matters a lot. And you can see on the left side, it is growing every year. 14% annual growth rate is there, and it's keep on growing. If you compare it with America, it is 1 million, यानी कि 10 lakh surgeries वहाँ होती हैं, क्योंकि वहाँ पे people are much more aware. they get the procedure done early because there is much more uniformity in the results. A small video just to showcase how the surgery can help those who actually need it. So I've just shared some videos before and after of the people who came from various corners of the world. This is an army officer. He came from Sierra Leone. This was the guy I was talking about, that psoriatic patient. He was like this, and he became like this after those 4 surgeries and 2 years of rehabilitation. This was a Kashmiri lady, very bad state, and after 3 months, she was on her own. This lady came from Aligarh. Again, the daughter was staying in Dwarka, so they wanted. You can look at the deformity; it has been corrected. This guy from Haryana. So it's quite revolutionary for a patient with genuine indication. It really helps them, to lead a normal life thereafter. This lady, you can see the weight also. She lost 28 kgs within 1 year of the procedure. So weight loss is actually possible once you get the right knees and you rehabilitate well. She came from Uzbekistan. After 3 months we went there, and this is the way she was walking. And this was bedridden for many years. And it took us a lot of effort in terms of, first day he was not able to walk because the muscles were so weak. We tried for almost 3 months the physiotherapy. Too much painful because she had been neglected at home for many years. Gradually we built onto the strength, the range. For them, going to the washroom, stepping few steps up and down was, something which is sort of a miracle. So, this story I think you already have seen, but there is something new which we got it done. Please play that video.
नहीं होगा। 27 साल पहले हमसे भी कहा था, इतनी जल्दी कहां बड़ी।
Our creative team tried to find out some data from Google and compiled it into a video. Not have the kids' picture, so I have to. I hope you know this story. And to end it, for the men with the force on a fast track for creating a world with foundation as strong as Keldikind, spreading happiness as Prega News, and with the ultimate dream or big, hairy, audacious goal of kindness, kindness and only kindness. Thank you.
That was really, mesmerizing. Thank you so much, sir, for your kind words. And the talk was so mesmerizing because I every time come here in the forum and I share the things that all of us know that lifestyle interventions, how important it is in our life, for sustainability, for survival, for the happiness. But just translating those knowledge into practice makes all the difference, and that is what the sir has emphasized today once again, to keep our bone health strong and to have a long, survival life without any disability. Thank you so much, sir, and thanks the entire team for joining this event. With this, we conclude this event. Thank you so much. Thank you.